Okay, welcome to the first module of the self-harm education intervention. So first we're going to jump to what we hope you'll learn from this intervention. So research suggests that college students who participate in peer education display significant improvements in their own leadership, gain interpersonal communication skills, increase knowledge in health promotion topics, develop higher levels of self-esteem, and improve their own personal health behaviors. So, as you demonstrate empathy and compassion for others, your own sense of emotional well being improves. Over the course of this training, we hope that you will learn about common mental health challenges facing young adults, in particular forms of self harm, how you may be able to educate and support peers that may be struggling, and how social media may be used to provide education about STB and NSSI and offer support to those in need. So, first, let's just talk about mental health challenges in college students. There are a lot of challenges that come with young adulthood. First, being personal challenges, which would involve moving to a new place, living with a roommate, or managing expenses. Intellectual and academic challenges, including speaking in class or joining study groups. Physical challenges could include coping with weight loss or weight gain, or finding time to exercise. Interpersonal challenges, including dealing with loss, developing and managing um, romantic relationships or friendships, and managing interpersonal conflicts. Career and lifestyle challenges may involve choosing your major, deciding on a career path, finding a job, things like that. So, we're going to ask you to reflect. So, think about your current life situation as a college student and what challenges, which of these that we kind of talked about, are you now experiencing in your personal maturation process? And this is just something we want you to consider as we move on to talk about mental health stigma. So, mental health stigma is broken down into three different categories. Stigma in general is broken down into three categories, but we are specifically going to highlight stigma involving mental health. But there's stigma in a lot of different things, in different minority groups and things like that. So, first we've got stereotypes, and stereotypes are just the beliefs of the stigmatized group. So, for mental health, common beliefs of people struggling with mental illness or suicide are that they're weak, they're crazy, or distressed. And then we have prejudices, which are the emotional consequences of stereotypes. So, as a result of believing that people struggling with mental health are weak, crazy, or distressed, people respond with fear, distrust, and anger. And then there's discrimination, which is unfair directed behaviors towards the stigmatized group, which is people struggling with suicide or mental illness, which is, and these behaviors include avoiding the people, treating other people with disdain, and coercion, which in this case is just trying to convince individuals that they aren't struggling or that it's not a big deal that they're feeling suicidal, for example. And all of these components of stigma have a few negative impacts related to mental health. So the top two are increased isolation and depression, which is not what we want for individuals struggling with suicide or mental health, and reduced help seeking. So individuals who experience stigma are less likely to seek help from a mental health professional, which is the opposite of what they need and what we want for them. So now let's talk about suicidal thoughts and behaviors, or STB, versus non-suicidal self-injury, or NSSI. So first, what are suicidal thoughts and behaviors? Well, suicidal behaviors are non-fatal acts to intentionally end one's own life, and suicidal ideation are thoughts of engaging in suicidal behavior, formulating a plan, etc. And interestingly, suicide ranks as a leading cause of death among young people worldwide. The World Health Organization reports approximately 800,000 annual deaths Among those aged 15 to 29, suicide is the second leading cause of death. So this is pretty prevalent, especially in college students. Your peers, you or your peers. And then non-suicidal self-injury is the deliberate, self-directed damage of body tissue. What's most important here is that it's without suicidal intent and for purposes not socially or culturally sanctioned. There are methods of self-harm that are part of cultural rituals and things like that, and that is not a part of what we describe as non-suicidal self-injury. And it's specifically without suicidal intent. And in terms of prevalence for NSSI, research suggests about 13.4% of young adults have reported ever engaging in NSSI, which is a relatively large percentage. Now, we really want to make sure that we're distinguishing the differences between the two, but it's also important to acknowledge that NSSI by definition lacks suicidal intent. However, NSSI is also the most reliable predictor of suicidal thoughts and behaviors and is often viewed as a gateway to suicide in young adults. So let's kind of combine what we've learned. We've got stigma and we know what suicidal thoughts and behaviors are. So what are common stigmatizing myths about STB? First is talking about suicide increases the chance a person will act on it. This is not true. Talking about suicide may actually reduce rather than increase suicidal ideation. It improves mental health related outcomes and the likelihood that the person will seek treatment. And opening up this conversation can help people find an alternative view of their existing circumstances. If someone is in crisis or depressed, asking if they are thinking about suicide can help, so don't hesitate to start the conversation. Number 2, people who talk about suicide are just seeking attention. People who die by suicide have often told someone about not wanting to live anymore or that they don't see the future. So it's always important to take it seriously when someone talks about feeling suicidal. Number 3, suicide can't be prevented. This is not true. Suicide is preventable but unpredictable. Psychologists are unable to really predict who's going to die by suicide, although we do know some risk factors. We can't predict it, and it's preventable. So most people who contemplate suicide often experience intense emotional pain, hopelessness, and have a negative view of their life or their future. Suicide is a product of genes, mental health illnesses, and environmental risk factors, and interventions that are targeted to treat psychiatric and substance use illnesses can save lives. So it can be prevented. We just need to point people in the right direction. Number 4, people who take their own lives are selfish, cowards, or weak. This is one that I have personally seen the most often. People don't die of suicide by choice. Often, people who die of suicide experience significant emotional pain and find it difficult to consider different views or see a way out of their situation. Even though the reasons behind suicide are quite complex, suicide is commonly associated with psychiatric illnesses such as depression, anxiety, bipolar disorder, schizophrenia, and substance use. So now let's talk about myths related to NSSI. These are a little bit different. So first is NSSI is a suicide attempt, and we've kind of already talked about this. But research into the underlying motivations for self-injury reveals important distinctions between those attempting suicide and those who self-injure in order to manage their stress and cope with overwhelming negative feelings. Most studies find that self-injury is often undertaken as a means of avoiding suicide. Number 2, NSSI is only cutting. This is simply not true. There are various methods of NSSI, including hair pulling, skin picking, burning, scratching, any other damage to tissue on the body is considered non-suicidal self-injury. NSSI is just attention seeking. For some, This is true. Self-injury is clearly an attention-seeking act. In this case, it's very important to honor the intent. If someone is injuring themselves for attention, then that person clearly needs it. The person is crying out for help. Now, the majority of people who engage in self-injury, however, often go to great extremes to hide their cuts, scars, or burns. Now, although not overtly attention-seeking, hidden self-injury is still a symptom of underlying distress, and it merits attention from others who are in a position to help. Number 4, only white females engage in NSSI. This is not true. Self-injury excludes no one. People who self-injure come from all types of groups, ethnicities, and economic backgrounds. They may be male, female, rich, poor, gay, straight, bisexual, questioning, educated, not educated, from any part of the world, jocks, skaters, preps, nerds. They can have demanding jobs. They can be teachers, therapists, medical professionals, lawyers, professors, engineers. It can be literally anybody. And it's impossible to classify someone as a person who self-injures or not just by the way they look like or the type of music they listen to, for example. So, now that we've learned about this, we're going to learn about peer gatekeeper skills. So what can you do to help yourself and others? Identifying warning signs. First, presence of unexplainable cuts, scars, or burns. Negative feelings such as sadness or anger, and dressing inappropriately for the weather. So looking at their clothing. Are they wearing long sleeves and pants in the summer when it's hot? That's the first step, identifying those warning signs. Then we need to learn conversation skills. How do we talk to the person about what they're struggling with these warning signs? So first we've got something called respectful curiosity, which is really just keeping respect for the person and being curious. It's okay to be curious and have questions. Just be as respectful as you can when asking those questions. Stick to I statements instead of you statements. Like, you should do this. You are being this way. Don't do that. You want to stick with I statements. I am feeling scared for your health. I am unsure of how to help you. I am, anything that starts with like an I, it kind of helps you maintain and show how you're feeling without putting your emotions onto the person. And then lastly, just expressing your concern, support for the person, especially if it's a friend in need. Just saying, I don't want you to die. I want you to live a happy, healthy life. Just expressing that concern and support and trying to help them see a potentially brighter future. And that may be difficult. It really depends on the situation. So the more important thing to do is to avoid shaming, blaming, or judging. That's like using should statements. Should, would, could. Using those statements usually puts shame, blame, or judgment onto a situation, and we don't really want to do that. That's usually invalidating for the person and their experience. And you also should avoid keeping secrets. Keeping secrets just puts a lot of stress on you and the other person, and could also result in negative circumstances that we don't want. So just make sure you're avoiding those things. So now we're going to think about our gatekeeper skills and apply them to this peer vignette. I'm going to read this, and then I'm going to ask you a question that you're going to answer in Qualtrics on the next slide, or on the next page. You first met Jessica your freshman year in your residence hall, as you both live on the same floor. Jessica is a nursing student, and when she isn't studying, she's hanging out with you and your friends, and she's very kind and sociable. However, with finals around the corner, Jessica has been noticeably stressed. She becomes tearful, seemingly at random, and is always worrying about all the work she has to do before the semester ends. Lately, she's been pulling all-nighters to get her work done and hasn't been sleeping much. She's stopped hanging out with everyone as much, and it seems like she's almost always studying or doing work. One night, you and Jessica go to the cafe for dinner, and she tells you she's feeling really down and is feeling overwhelmed. She tells you she's been having difficulty sleeping and is losing interest in things she typically enjoys doing, like yoga and hanging out with friends. She tells you she's been scratching at her skin and has even cut herself. Just so I could feel something, but I've only done that a few times. It wasn't a big deal. So, how would you talk about or ask about suicide or NSSI, and how would you refer this peer to a service? How would you respond to this person who is clearly in crisis?